Good morning, Dr. Mallory.
Good morning, Josh. How are you?
I'm good. How are you?
Good. I'm doing great.
Could you start us off with a quick introduction of who you are and what you do?
Sure. So my name is Mia Mallory. I have two jobs. I have a day job and I have a night job. So my day job is the Associate Dean of Diversity, Equity, and Inclusion at the University of Cincinnati College of Medicine. I've been doing that for the last 7 years. And then my night job is I'm a pediatric emergency medicine physician at Cincinnati Children's Hospital. So I work nights, overnights, holidays, and weekends at the hospital.
And what would a typical day be like for you?
So for me, since I have both jobs, so my job, my time has changed over the years. And I was just, working as a physician and then taking on this administrative role. So currently, my day job with the diversity job is doing a lot of support for students. So my job is recruiting students, residents, and faculty who come from diverse backgrounds who are underrepresented in medicine. So I do a lot of recruitment and retention efforts with them. So that my whole day is taken up with that and doing support with them and programming. And then also, I sit on the admissions committee for the medical school, and I sit on other curriculum committees and those kinds of things. So that now that we're in kind of a virtual world, I do a lot of WebEx meetings. And right now, we're really focusing on how we can recruit diversity, from a virtual standpoint. So I've been meeting with a lot of departments and a lot of groups are really discussing that. And then, so I work in the hospital several times a month. And so typically I will be in my office, at the medical school for my diversity job most of the day. And then I'll work a shift in the hospital mostly till 1 or 2 a.m. So sometimes my days are pretty long when I have an ER shift. So those can be kind of crazy, but those days. And I probably work about 2 weekends a month at least. And so less than I did when I first started in medicine. So I would work a lot of weekends and more shifts. And then as I've gotten older in medicine and taken on more administrative roles. I work less clinically and then more administrative. So I probably work the least now than I ever have worked in my career. So this is probably a good time for me to be doing this kind of work because I work less in the hospital.
So I know you just said you work less, but with being a mom also, how do you manage your time? I know that's something a lot of people will be wondering about.
Yeah. So I'm a single mom. So my daughter is now 17. So now doesn't matter to her when I work, but when she was younger, it was certainly a challenge because it was just me, really doing most of the work and making sure she had care and, getting her to activities and those kinds of things. So that was harder. And I remember when she was younger, she used to say, I hate your job, you work too much, and now she's 17, so she doesn't care like
Yeah.
what I do. But so it certainly has been a challenge. And so you have to find this village of people that really kind of help you. And really, I remember when I used to work in Atlanta for 2 years. I worked in an ER there, and it was just her and I. And because Atlanta is a crazy city with traffic, our ER shifts used to start at like 6:30 in the morning, which is difficult when you have a child because there's nowhere for them to be. Before 6:30 in the morning when I'd have to leave at 6 a.m., there was no place to put her, right? And so really finding childcare and friends and family to kind of help you out is really tough. And so as a single mom and as in even just being a parent, I think balancing medicine is difficult. And so you really have to find this village to really help you. And so now that we're on, these years with social media, I'm on, a lot of Facebook groups and there are a lot of parent groups. And so people share and swap nannies and give their best advice on how to find childcare. And now my daughter, who's 17, she babysits some of my doctor friends' kids, which is kind of cool. So you have to really find this village and really and have backup plan and backup plan and backup plans for your backup plans, really. And so making sure that you have so much because it's certainly a challenge, but it's something that I would not have changed. I had a child really late in life, and so I was already a doctor when she was born. Some people are all have children while they're in medical school or their residency, and they're while they're training. And so, I think to me that's more of a challenge because you're trying to study and do a variety of things. And so, um, just finding serious backup plans are really tough. And so that's so I probably had 5, 6, 7 babysitters that were lined up to make sure. And then I work overnights. I work in the hospital, so while people are asleep, I'm working. And so making sure that there's someone who can do that, I mean, you have to be able to trust people too, right? So you're leaving them with your most precious gift. And so you're spending the night at your house or whatever. And so that's certainly a challenge, but it's absolutely what I would have done in my life. And medicine is the thing that is my calling. And so I absolutely wouldn't change it. Now, my teenager, who is about to head to college, she wants to do medicine, even though she said when she was younger she hated it. I work too much. I hate my job, and now she loves it. So maybe that worked out for the good.
And whether it was in undergrad or med school, residency, or whatever it may be, could you talk about some of the challenges that you faced being a Black woman in medicine?
Well, I think it starts way back. I think you don't. There aren't many doctors who look like me, and I never met one, so I always wanted to be a doctor when I was younger because I liked science and I liked blood and guts. I liked weird stuff like that. And I lived in a neighborhood that had a lot of old people, and there were ambulances that would be going to their houses and taking them to the hospital for a variety of things, and I used to chase them. I used to follow the ambulances and just see what they were doing. And the paramedics, like, they got to know me in the neighborhood because I would be like, "Hey, what is wrong with him?" And and so I kind of learned. And so my interest in medicine started pretty early, but I didn't see one person who looked like me who did it, and no one in my family went to college. I didn't know any soul who went to college, so I didn't see any folks until I got to high school, and I remember taking an IQ test, and I remember and I did well on it. And I remember my guidance counselor came up to me. He pulled me in his office to tell me how great I did on this IQ test, and he's like, "Mia, you should be a flight attendant." And I was like, "A flight attendant?" I'm like, "Is that like a waitress in the sky?" And he was like, "Yeah." And I was like, "So." He's like, "Women aren't doctors, right?" And so that was discouraging because there wasn't really any mentorship to really show me how to do it. So I had to learn how to do it my own way. And so I think, with being an African American in medicine, there aren't many people who look like us. And so there's lack of mentorship to like pull you along the way, which is why I do what I do, because I didn't have it. And so to have someone who is there for you to help you guide you through that path is huge. And then, so that's a big challenge. And then you get so because we are a minority in medicine, you get patients who have um, fears, and biases about me taking care of them. That's a big challenge in medicine, right? And so I have had patients who don't want me to care for them because I'm Black. And so for me, someone who came from, a first generation, poverty background with no one who ever went to college and, had no way, and to have worked as hard as I have to get where I am. And for just someone to discredit that because I'm African American, it's hurtful, right? And so that's a big challenge that I think a lot of us face in medicine because people don't trust us. They don't think we're as well trained. They don't think we're smart. For whatever reason, we're not the same caliber as someone who's a white physician, right? And so that's a big challenge. And I think the challenge is like, the system wasn't built for African American physicians, right? We talk about systemic racism, right? And so it really wasn't built for us. And so promotion and retention and all of those things that happen automatically in majority of populations of physicians doesn't automatically happen with African American physicians. So we have to fight to kind of get our way in there. And so, and when I left medical school a long time ago, African Americans were 4% of the population of physicians, and right now it's pretty close to the same. And so I've been out of medical school for over 25 years, and so for it to still be the same, and the population of patients that we're caring for is becoming increasingly diverse, and so soon minority populations will be a majority, and so patients who look like me want doctors who look like them, right? And so So that's one of the reasons I do what I do. And so the challenge really is, you know, making sure that people recognize the value in who I am and the training. I'm just as good as any other doctor, and I took a different path to get here, but you know, I'm equally qualified. And so that's been an interesting journey. And it wasn't something I ever thought would happen. You know, when I was training, when I was going to school, like, you know, no way people would not want me to care for them because I'm black. Like that doesn't even make sense. And even, you know, even being a woman, you know, like, you know, people assume physicians are men, right? And so that's changing because now at UC College of Medicine, at least 50% of our um, population of students are women, which is amazing, right? But that wasn't the case. Before I went to medical school, I was a pharmaceutical sales rep, and when I was doing it, it was mostly women doing it, and we would meet with, you know, have appointments with doctors to talk about your specific, you know, drug that we were, you know, selling, and most of the people that I met with were white men, and you know, I never, even in that job, I never even saw a black physician, and so most of them were men, and most of the people who had my job were women, and so, you know, just, you know, getting out of that mindset that, you know, women can be doctors too, you know, is really interesting. I have a nurse friend that brought her kid to the ER one time, and I've seen her kid in the ER like several times. Now he's a grown up, but I saw him in the ER, and he assumes that doctors are women. And so when he went to his pediatrician, his mom, you know, signed him up for his pediatrician. His pediatrician was a man. He's like, you know, men could be doctors. I'm like, yeah, men could be doctors too. So, you know, just changing the narrative, right, and the, you know, the visual, like who we are. And so so that's my job, is to really just promote that.
So with being on the board of diversity and inclusion at the College of Medicine, was your experiences, did they have a role to play in that, or was it more of an opportunity that kind of stumbled upon its on you?
Oh, good question. So when I did training, so I did, I'm from Pittsburgh, and then I did medical school there, and then I went to Dallas, Texas to do residency training, and then I was a chief resident, which is an extra year where you know, get to help teach and train other residents, and then I came to Cincinnati to do my pediatric emergency medicine fellowship, and shortly after starting that, I became the associate residency director, and so I was one of the people who helped select and support residents training at Children's. And so in that role, I had the opportunity to work on increasing diversity in our resident pool. Because before I got there, and the person who was the residency director, Dr. Javier Gonzalez Del Rey, who is from the Dominican Republic, most of our residents were majority, came from majority populations, right? And so he and I were like, we really have to change this. The patients that we see, you know, look like me and you. So we really need to work on that. So that's something he and I really worked on. And in the meantime, when I was you know, doing that, I did that for about 8 years. I was doing work with the Office of Diversity and Inclusion at the med school at the time. Dr. Charles Collins was running it, and he's a psychiatrist at UC, just retired. And he would have several of us, you know, mentor medical students. We sat on committees and those kinds of things. So I really got interested in some of the recruitment work that he was doing when I was doing my residency job and his faculty, and just mentoring medical students, especially when they came over to Cincinnati Children's. So then I went away to Atlanta for a couple of years, and I worked in the ER there. And then and then the opportunity to take the job for the Office of Diversity, Equity, and Inclusion came up when Dr. Collins was transitioning into leadership in psychiatry. And so the dean of the medical school at the time, Dr. Boat, asked me to come back and do the job. So that's how I ended up kind of doing the job. And I've been doing it for the last 7 years.
Okay, now time for the big question. Everyone wants to know. So you said you work in admissions too. You have some work in admissions.
Yeah.
So the big question is everyone wants to know, what are med schools looking for? What could people do to boost their applications? All that.
So it certainly has changed over the years, right? So when I was applying, we could take the MCAT, you know, more than once. You know, it wasn't as heavy, and it was really focused on grades and scores and all that other stuff you did. So now medical schools are really paying attention. We keep talking about this holistic approach, but we talk a lot about the distance traveled, and we pay a lot of attention to that at UC College of Medicine. So um, distance traveled is really like my story, right? So students that have taken, you know, the path that they pay attention to, the path that they took to get there, and really recognize the struggle that some people have, but also equating everything together and not just making grades and scores the only thing that is used to select people to go to medical school. So all those things that add to your application are things that you've done outside of grades and scores, right? So grades and scores obviously get you in, but people pay attention now. So when I was in med school, we all got compared as the same group, right? So now we look at MCAT scores as we compare them with your own group, right? So it doesn't make sense to compare African American MCAT scores to Caucasian MCAT scores. It doesn't make sense, right? Because we test differently, test our bias, and we know that. And so some people don't have access to. People may have learned how to take standardized tests. There are some people that academically have never really learned, and so some people start at a disadvantage, and so it doesn't make sense to compare. MCAT scores of one, racial and ethnic group to another. So we pay attention to that. So when we look at MCAT scores, like the mean in the nation is like 515, right? But the mean for white students applying to medical schools is 513, but the mean for Black students is about a 505, right? So we make sure in a admissions committee we pay attention to that. So someone who happens to be African American who has a 505, looks different than a white person who has a 505, who has academic privilege and all those other things. And so people pay attention to that. So we make sure that we're comparing groups compared to the group that they most identify with. And so that's one of the things. And then GPA as well, right? So, pay attention to a number of science courses that you took, and your science GPA is everything. Nobody cares about that other stuff, sadly. Like I took ceramics in college thinking it would help boost my GPA, but it didn't really help, right? So, paying attention to science classes, science GPA, that's a big thing. But people also pay attention to because when we get to freshman year, you know, people have a lot of trouble, adjusting to college. I have a feeling my teenager's going to have some trouble with it. So just adjusting, and so learning how to study in college and learn how to really, focus. So we pay attention to, we call it a rising GPA, right? So freshman year, you might mess up. It doesn't sound, feel like you're not going to do it, but just paying attention to students doing better as they become a sophomore and a freshman, they really figured out, a sophomore and a junior, they really figured it out. And they've learned how to study. They've gotten tutors, they've gotten resources, they've gotten help. And so you're like, they may have started kind of low when they were freshmen, but as they progressed, they figured it out and they did better. So that's one piece. But then there's 18 other things that are part of your application that is equal to the grades and scores. And grades and scores no longer are the major player in admissions things. So what people bring to the table. So people who have done community service, those kinds of things. People who have done, we talk about medically related experiences. So that can be anything from shadowing to doing research to, doing global health work, or, holding a job, because many students hold jobs while they're in college and they're not able to do other things because they're working. And so people pay attention to that. So all of those things together, we think of the whole person. So you might say, well, this person didn't have as many medically related experiences as this person. But then you say, hey, he had to pay for his entire or partial part of his tuition while he's in college, and he had to work full time. So couldn't do it because he was working. So people pay attention to that. And we pay attention to people who come from underrepresented backgrounds, people who come from first generation backgrounds, people who come from financially disadvantaged backgrounds, people come from rural communities. So we pay attention to all that. We pay attention to family situations, right? So there might be someone who comes from, a family that only has one person working, or maybe their parents both only attended high school and they weren't able to, provide, for their child. And so, so all of those things come into play when you're considering the entirety of the application. So it is good to have all of those things, but some people don't have those opportunities. They're working full time, they're helping support a family, they're doing a lot of things and they don't have the opportunity. So so not every application is equal to each other. So maybe someone has 15 experiences that they had, and they had, opportunities for tutoring and review courses and things that some students just don't have the opportunity for. And we make sure we pay attention to that. And then also the opportunity for mentorship, right? So some students, they don't get very good advice in med school, and so in applying to medical school. So I just met someone the other day who graduated from UC who's interested in medicine, and I've never met him. So he's been here 4 years, and I've never met him. And so making sure that they've had good advice going through, and so before they apply, we hope that they would connect with someone who works at a medical school or has some advising capability, so that they know that they're getting the right advice. And before they even try to submit their application, because I'll see applications from students and I'm like, why did you even write that on your application? So you wish that they would have come to you beforehand, and just to make sure that they're getting the right advice. And so I think there's so many factors that come into it. And before, grades and scores were heavy, but they're not. I mean, obviously there have to be cutoffs, right? There are some grades and scores that you recognize that these students may struggle with the academic rigor of medical school, right? So those students have to be able to, recognize that, and for mentors to be honest with them. So I think there are cutoffs, but there are also a wealth of things that go into the application process that is not all grades and scores. So everything that they do outside of it, and so people even take a few years off to do a variety of things. You bring something different to the table, and the other piece is like not everyone has to be a science major, right? So you don't have to be a biology major and a biochemistry major to do it, because you bring something different. We have music majors, we have language majors, we have English majors, we have different people who bring different things, and so they add diversity to our class. And I think a lot of medical schools are looking for that as well.
Dr. Seltzer, do you have any questions?
I think the two that I'm thinking of, because I know we're getting near time, but that might be one we saw from students that they want information on the registration form. Number one is what suggestions might you have for the gap year, the growth
Yep.
year?
Yep.
And then also, if you had one single piece of advice you could give to a UC undergraduate pre-health student, what might that be?
Got it. So the gap year. So back when I was training, again, gap years were not common, right? So now they're very common, right? And some schools actually encourage gap years. So there's a couple of things with the gap year. So if they're doing it because they want to break, because they don't want to go into medical school and then residency and all that, and just have their life kind of taken away. So they just want to break before they start it, and they are not struggling academically and everything looks great, then they can do something that they've always wanted to do, right? So they can do Teach for America, or those kinds of really cool things, the Peace Corps, or really cool stuff. They can backpack in Europe. They can do, backpacking in Europe may not happen with COVID, but so they can do those kinds of things to really just kind of build who they are as humans, take a nice little breather, and then jump into the journey of medical school and residency. So they can pretty much do what they want to do. Now, the people who are, do it because they want to boost their application academically, then we try to get them to do other things. So there are a variety of post-bac and master's programs that we encourage them to do when they're considering a gap year. So they can get a master's in science. There's a bazillion programs around the country that does it, and they're preparatory for medical school. And so they're specifically aimed to get you into medical school. Or they can do post-baccalaureate courses where they may have like stumbled on a few courses like organic chemistry and physics, in undergrad, and they can retake those in a different time frame, where they're not taking 4 of their classes, and kind of redo some of that. Or they may need to take the MCAT and prepare for it. And I always tell people, make sure you take a review course. Like, don't try to take the MCAT cold. That is not a good idea. And you only want to take it one time. So invest in the MCAT course. There are several that offer discount for people who have financial hardships. So invest in a course. Don't try to take it and just guess, or just, using books from a course. Like, take an MCAT course. So some people will need that gap year to work on the MCAT, and or some of their experiences. Some people undergrad, I mentor someone who played football undergrad, and he really wasn't a big science major, and then he decided later that he wanted to do medicine. So he took that gap year to start taking some of those science classes he had never taken while he was an undergrad. So the gap year is really varied based on what they're doing it for. So I make sure I tell them that. And then there's, a lot of piece of advice, but I would say there's a couple things. One is find a mentor, right? So mentors are busy and it's hard because, we get lots of emails and it's tough. And so you don't want to be a pest, but you want to make sure you have a mentor, because you got to find a mentor who's active in the area that you're interested in, right? And so not someone who, is retired and hasn't done it in a while. You want to find someone who's actually doing. So finding a mentor. I think the reason that, you may have heard about a study that talked about the number of Black men in medical school, and the number was higher in the 70s than it is today, which is crazy. So part of it is because they lack mentorship and lack, early in high school and, early college. And so finding a mentor who knows what they're doing is my biggest piece of advice. And then not only finding the mentor, but listening to the mentor. So I think people struggle with that. So, so many times I'll see them and, we've worked on their application and then they do something that I'm like, why did you do that? So, please listen to your mentor, because they know what they're talking about. And I think students like to get advice from other students who applied, or students that are a couple years ahead of them in college and how they did it. And I always tell them that's cool, but you definitely need to get information from someone who actually is doing it. And I would say most colleges have some connection to a med school, someone like me, or, a diversity officer, someone, or, admissions counselors who can really make that jump for you, that connection that people don't have. And, and then join societies like in your undergrad that specifically are targeted towards medicine. And the amazing course that you run, Dr. Selzer, that is amazing. So if you have the opportunity to do something like that, where you get a head start and a jump, and, I had no clue how to do medicine. I had no clue, people thought I should be a flight attendant, like no disrespect to flight attendants, but it's not what I wanted to be. Right. And so when I got to college, I went to a college where there were only, mostly it's a liberal arts college for women. And everyone was getting a BA, and me and like three other girls were getting a BS. So like three of us who were like science group, but our classes were tiny, and I got to know people really well. And I took a class by myself. I took a physiology class all by myself. And that professor and I became like best friends, and he helped me really apply to medical school and really was a huge mentor. And so finding someone who really supports and sponsors and who knows what they're doing, because not everybody can do this, right? And not everybody is giving you the same advice and giving you the right advice and the up-to-date advice. I'm always making sure that I'm giving them up-to-date advice, because I don't do residency education anymore, but I mentor my medical students into residencies. So I make sure that I'm telling them the right stuff. So I check with the residency, program directors to make sure I'm telling them the right stuff. So making sure that that person is up to date, and, and then also finding someone who is a medical student. I think that's a huge thing, because you have to make sure this is what you want to do. And so, we have a minority organization called MAPS, Minority Association of Pre-Med Students. And those students are connected to our minority medical students. They can shadow them in class. They can, kind of learn what their life is like. And so some students, they get to med school, and, med school is a jump off of a cliff compared to college. And so I think students don't recognize that. And so when they see that, either they're still motivated to continue, or they're like, this is not for me. Maybe another path is for me. And so I think mentorship is huge. And then making sure they're connecting with someone who really knows the process.
All right. Well, thank you so much for that, Dr. Mallory, and thank you so much for your time. That was extremely helpful. I know a lot of students will get a lot out of that too.
Thank you, Josh. No problem. We'll keep chatting. Thanks for letting me do this.
Of course. Okay.
Thank you so much. Thanks to both of you.